Who do I have today? So no reasons for your pain, huh? Okay. Anyways, hi. Are you my cancer? I'm not cancer. What do you mean? I mean cancer. Do you have cancer?
Cancer?
Yes. Who are you?
I'm her wife.
Oh. That's shocking.
Why is that shocking?
Well, it's uncommon. Just not, a popular choice, I guess. What were we complaining of again? You have a migraine. Okay. I need to ask you some questions.
Very loud. Can we go somewhere more private?
No, sorry. There's nothing we can do for you. So you just gotta chill. Alright. Yeah, since you said you have a headache, right? Migraine. Okay, a migraine. I'm gonna ask you a few questions. Can you tell me if you took Tylenol?
Yeah.
Sorry, did you say aspirin? Tylenol. Okay. How many times did you take it? Did you hit your head?
So I took it.
Did you hit your head?
No.
No? Okay. Did you fall then?
No.
And what have you done in the last few days? And the pain started when?
So it's been like
Sorry, from a scale of 1 to 10, just grab that question. From a scale of 1 to 10, how bad is it? With 10 being like the worst pain?
I would say it's definitely
A 6? So you couldn't manage a 6? You can't manage a 6 of pain? Well, I'm just wondering, this is unusual for your previous experience with like migraines or whatever? No? Yes?
Consistent, I guess.
More okay, sorry, just let her answer the questions, okay?
I'm very confused with all these questions.
You know what, let me just make this easier for you to understand, right? So where exactly is the pain? Is it on your temporal, occipital, frontal, or parietal?
I don't understand these parts.
You don't understand those parts. It's just general anatomy of your brain, guys.
I have a migraine. I don't know which part you're talking about.
So you can't tell me anything.
I think it might be like possibly a brain tumor.
Oh, brain tumor. Okay, you don't have a brain tumor. Okay, you're fine.
How do we know that?
Okay, well, I'm sure she's jumped into conclusions. Maybe you guys got paranoid from reading WebMD or something, but yeah, you're fine.
I think it's a brain.
No, it's probably not a brain tumor. Anyways, I need to take a look at your head. So let's just touch.
No. Please do not touch me.
Why? My hands are fine.
I don't know. Ask for my
So I need to ask. Oh, since you guys obviously don't want my help, let me go find you another nurse. Is that cool?
You need to find another.
Bye. Hey Brandon.
How's it going?
Horrible. So I have this lesbian family thing, and they're so rude. They don't answer my questions. They don't understand anything, and I can barely get them to give me any information. So I need you to go and take over my assessment because the girl doesn't want me to touch her head. So she doesn't feel comfortable with me. I don't know what's the problem is. So can you go and do it?
Sure. Pretty late. It's Friday. Why don't we just take a break? So just go back after.
No, you're right. Let's go for lunch.
Just go back, and when you do, just prescribe some Tylenol.
Right. I'll just give her migraine medication. Yeah. Why do I have to document anything? This patient can just take Tylenol on her own. Or I have to go tell her. It's stupid. Slow down. Slow down. Let's get this over with. Hey, I'm back.
Where have you been? We've been waiting 30 minutes for you.
Oh yeah, so
Were you on lunch?
yeah, I took lunch. And I tried to look for a nurse, but there are no other nurses around. I don't know, it's like dry today.
There's so many nurses walking around.
He just wears the same scrubs as me because he's a friend. Okay, anyway, so since someone can assess you, and you sure you don't want me to check your head? Because at this point, I'm like your only shot you got.
I don't want you to touch my head. That won't work.
Okay. Alright then, I don't know what to do for you other than to prescribe bed rest and Tylenol.
Nurse, that won't work either. I've tried all sorts of migraine medication. I just want to try to sleep.
Sorry, what did you say?
I think it's a tumor. I really do think it's a tumor.
You really think it's a tumor? Yeah, come on. You look fine, okay? You can walk, you can talk, you know, you can smile. You know, people like go through worse and they're like, you're fine. It's just a little pain.
Nurse, it could be.
If it was internal, you know, you have other symptoms, but you don't have any other symptoms. You only have a headache.
It's a migraine.
It's a migraine. Oh, I thought it was a headache.
I've been telling you for the past 10 minutes that I have a migraine.
Oh, okay. Okay, well, you know what, ma'am, just relax. You're okay. You're just having anxiety over this migraine. You know, a lot of people like to diagnose themselves, and it really means nothing. So just go home, take Tylenol again, and wait for the migraines to pass. That's my conclusion. No other nurse will see you today, so you're not your team.
This is so unfair. I mean, you're turning me away, and all that's for is your help.
You know what? I've helped you, so don't worry. Come back next week if there's, or you know what, next month if there's a difference. But there probably won't be. I'm pretty sure that you just have a simple migraine and it's going to go away if you take bed rest and actually listen to me and take other migraine medications. Okay? So I'm done for the day. That's it. I've written all your information on your charts. Alright, bye.
We need to go see another nurse because I don't know what that was. I agree.
Hello, my name is Sulaiman. I'm a nurse at this hospital, and I would like to do an assessment today. Is it okay if I take a seat?
Yeah, sure.
Okay, thank you. So if you don't mind, may I please see your wristband real quick?
Yeah.
Okay, thank you. Can you state your full name
It's Manna
and your date of birth?
March 25th, 1995.
Okay, thank you. So before I begin, I would like your consent for me to record this information and that the information will be shared among other healthcare providers within this hospital. Is that okay?
Sure.
Okay, thank you. So, let's see. So, would you prefer to have this assessment alone?
I think so, yes.
So, yes. Do you mind stepping out just for a couple minutes?
No, not at all.
Okay.
I'll be right back. I'll be right outside, okay?
Yeah.
Thank you for understanding. So, can you please tell me what brings you in today?
So over the past couple of days, I've just been having very intense migraines, and it just hasn't been going away.
Okay, so you're experiencing intense migraines over the past couple of days.
Yes.
Okay, if you don't mind, I'm just going to ask you a couple of questions based on your migraine, just to have a better understanding of the situation. Can you please tell me your pain? Is it in one specific area or all over your head?
It's mostly just in like the forehead area. Yeah.
Okay, sorry, can you please just give me a second to write down all this information? I don't want to miss anything. Can you please describe the pain?
It's kind of like a throbbing. It's just like all, it doesn't go away.
Okay, throbbing. Okay. Could you please elaborate on that?
Well, basically, I do work at a accounting firm, so I do have to stare at the screen a lot, and it makes the migraine worse, I think.
Oh, please, go on.
And I also have a family history of cancer, so I'm very worried that it's going to be cancer.
I understand that you're worried. Please, let me just ask a couple more questions on this topic.
Okay.
So, on a scale of 0 to 10, 0 being no pain, and 10 being the worst pain you've ever had, what number would you say it is?
Well, when I get the migraines, it's usually a 6 or 7, so it's pretty bad, I think.
Oh, okay, 6 or 7. And when did you notice the pain started?
Approximately 3 weeks ago, I think.
About 3 weeks. Okay. Okay, Susan. What do you believe is the cause of this pain?
Like I said, I do have a family history of cancer, and I'm really anxious that it's going to be a tumor, so I'm very stressed out about that.
Okay, I understand your concerns. They are justified, so let me look more into that. So, I do notice that you are wearing a headscarf. So, would you be more comfortable with me doing the assessment, or I can get a female nurse to do it?
Wow, thanks, Brandon. That's so considerate of you. I would prefer it if a female nurse assessed me.
Yeah, okay, that is no problem at all. So, if you can just give me a second, I will try to find one of my colleagues and get someone to assess you further. So, can you please wait right here, and I'll be back shortly.
Okay, no problem.
nurse here at this hospital. I'm going to be doing your physical assessment. So do you want to follow me to a separate room? Sure.
Hello, Sandra. How are you today? Would you prefer to have this conversation alone?
If that's okay with you.
Yeah, it's okay.
Thank you for understanding. This is Sandra. Can I please escort you somewhere more suitable?
Sure.
Thank you.
I'll be right outside.
So I understand that you've been diagnosed with a brain tumor. How are you feeling about all of this?
It's just a lot for me to handle. I'd never expected brain tumor. I'm very stressed. I have kids. I have work. I never should have come into this appointment. I'm so overwhelmed.
I understand it must be very stressful. Do you mind if I hold your hand?
Sure.
Well, I know this must be very hard for you. What I do want you to know is that the doctor has cleared you for a few treatments. So he's prescribed surgical and chemotherapy. These treatments are available to you. We also offer supportive services at the hospital for those diagnosed with cancer. Is that something that you'd be interested in?
Yeah, that would be amazing, actually. I think right now I might be leaning towards chemotherapy. Do you think that'll cure the cancer?
It's okay to be feeling all these feelings that you're currently having. As for curing the cancer, we won't fully know that until we run diagnostic tests, and we can't do that until after the chemotherapy. But what we can do right now is just discuss the situation. Do you have any questions?
I'm just confused about what to do next, how I should proceed.
Oh, okay. Well, the first thing we would do is schedule an appointment. But we don't have to jump into that right now. There are some supportive services, such as counseling, that we could schedule for you and your family. Is that something that you'd be interested in?
That would be amazing, actually, yeah.
Okay, we can get that set up. Are there any questions that you have currently?
If I need to reach out to someone, can I do that?
Yeah, me and the nurses are here for you all the time. Myself and the doctor as well, we're always available to you. We don't want you to feel alone, because we understand how much of a difficult time this must be placing on you and your family. So if anything comes up, just contact us, okay?
Thank you so much.
Sure, no problem. Is there anything else I can do for you?
No, I think I would just like to sit with this information for a bit. If that's okay?
Yeah, that's all right. Would you like me to go and grab your wife so you can sit with you?
Sure, thank you.
Okay. Hi, Mrs. Singer.
What's going on? I'm so worried.
Okay, so I talked to Susan about the diagnosis, and all of the information that we discussed can't be shared, unfortunately, because of patient confidentiality. But what I can do is sit with you guys and discuss any questions that you guys might have, any concerns about the diagnosis and about what to do.
Okay.
Okay? She's ready for you.
I can go in?
Yeah, you can go in. Go ahead.
Okay, thank you, nurse. No problem. How are you feeling? What's going on?
I think we're in really good hands here.